Today, we are going to discuss about vaginismus. What is vaginismus? To start, let me explain what vaginismus actually is. Vaginismus is a form of pelvic floor dysfunction where the pelvic floor muscles involuntarily contract or spasm when penetration is attempted, and this doesn't have to be sexual penetration. Even using a tampon, inserting a finger or using a menstrual cup can be difficult, if not impossible, for someone who is suffering from the symptoms of vaginismus. And whereas it is normal to have some difficulty and pain when you first try to use a tampon or you try sexual penetration, this usually results with practice. But in the case of vaginismus, there is no progression. Even with consistent practice, it can feel like there is a wall preventing penetration, and this is due to the contracted pelvic floor. It's important to remember that these contractions are involuntary, so you have no control over them. These involuntary contractions can be viewed as a protective response from your nervous system. How is it diagnosed? You don't self-diagnose the diagnosis. The diagnosis is typically made by a gynecologist. You should contact your gynecologist beforehand to let them know if you think you can have vaginismus, because this will ensure that they are aware of your fears ahead of time and they can prepare properly for your visit. When you have your exam, they should begin by giving you a mirror so that you can look at your vulva. They can explain what the different parts are, and they can talk you through the exam before they begin. A speculum is often used for gynecological exams. They may be able to use a small speculum because of your vaginismus. Before they use a speculum, they will likely use a Q-tip to see if you can relax for that. And if you are okay with the Q-tip, they may guide you to insert either one or two of your own fingers to see how you manage with that. They are going to proceed with the exam if it's possible, and they will grade your vaginismus if they find you have it. Even doctors don't know exactly why vaginismus happens. It's usually linked to anxiety or fear of having sex, but it's not always clear which came first, the vaginismus or the anxiety. Some women have vaginismus in some kind of situations or with any sort of object.